Hello, everybody. My name is Dr. Ann Auburn, and I'm the owner and founder of the Natural Health Improvement Center in Granville, Michigan. Tonight, I'm here in Pittsburgh. I'm actually attending a conference for the International College of Integrative Medicine. We're talking about dietary practices for best health. It's been really interesting so far, but I'm taking the time tonight to record this lecture for Facebook Live so that I can share with you some of the secrets to immunity with ozone therapies. So let's get right to it. All right, first let me define ozone. Ozone is a colorless, unstable, potentially toxic gas. That really means that if you breathe it into the lungs, it can irritate the lungs. We'll talk more about that later. It has a pungent odor and it has powerful oxidizing properties. That's what we use for our medical applications. And it's formed when oxygen, or O2, is struck by electrical discharges. Now, this can be, lightning or ultraviolet light when waves are throwing all those little bubbles of air up in the air, or waterfalls do the same thing, and the sunlight hits it. It'll split that O2, that's the oxygen we breathe, into singlet oxygen, and then 3 of those oxygen molecules is brought together and makes ozone. Now, we do this in a very calculated way in the clinic with an ozone generator, so we know exactly how much we're getting and how much we want to use for various applications. So is ozone toxic? Well, not really. I mean, not to us, really. It can be irritating to the lungs if you breathe it in at high concentrations for a long period of time, but it really isn't like a toxic pollutant. People get confused because ozone is often measured as a measure of pollution, but that's because it's the easiest thing to measure when you're assessing pollution because it's trying to neutralize all the pollutants. And so if there's a lot of ozone, in the air that's collected, then that means there's a lot of pollution there too. So ozone really isn't toxic the way that we're using it. It's very, very safe, and we'll go into some of those specifics about safety later. All right, so on this slide, we're just trying to demonstrate that ozone does kill bacteria. In the one Petri dish where it says control, basically there's 500 million E. coli bacteria sitting in that tray, growing in that tray. And then after 2 hours, it's been treated with O3 or ozone. That Petri dish, you can see the surface is extremely smoother. The bacteria are basically gone. And so, yes, ozone is toxic, but it's toxic to bacteria, viruses, fungi, and parasites. So essentially those pathogens you might run into in life that might cause an infection, it will kill all of those on contact very, very quickly. So when ozone is introduced to bacteria, the bacteria is the green tubular thing there, and the ozone is the 3 silver or gray looking balls. What happens is it attaches to the bacteria because it's very reactive, remember? And when it does that, that very reactive energy, it basically causes oxidation, it punctures the cell wall, and the bacteria is destroyed. And really only oxygen remains after that's done. So that's how ozone works to kill bacteria. So that is a good thing. We want it to be toxic to these bacteria and other things that might cause infections. In fact, ozone inactivates numerous human pathogens. You can see the list is extensive here, 63 different bacteria. Some of them you may have heard of, like Salmonella, Legionella, 15 viruses. I mean, these are just the known ones. They've been proven. So basically, you could say it's a very strong antiviral. Things like polio, Coxsackie, Echo. I know another doctor in my group that has done studies with Ebola. He actually treated Ebola and saw people saved by ozone therapy. 25 fungi and mold spores. So this could come in handy, like if somebody has mycotoxin illness. Aspergillus comes up a lot when we do mycotoxin testing. Other fungal pathogens, Alternaria, Monilinia, et cetera, and also protozoa, which are like parasites. Giardia, Cryptosporidium. So there are many pathogens that are just knocked right out by ozone, so we use it a lot for infections in the clinic. So this slide is to illustrate how ozone is created. We mentioned that earlier. I've got a picture of a crazy mad scientist. You can just insert my face there. But oxygen is, we have pure oxygen from an oxygen tank. It goes through an ozone generator, that green little area that represents that corona electrical discharge. It hits the oxygen, splits it into singlet oxygen molecules, and then those come together to form triplet oxygen, or the ozone. So that's how we make it in the clinic. And depending on how fast we have that oxygen going through the ozone generator, that will help us control whether the dose is high or low. And we use different amounts, different dosages for different things in the clinic. So I just want to emphasize here that we do use medical grade oxygen. You may have heard of these commercial ozone generators, air cleaners, things like that. They take the oxygen that's in ambient air, the air that we're breathing, and it's got a lot of other things in it, nitrogen, hydrogen, other things. We want to use medical grade 100% pure oxygen when we put it in that generator, so that we can control exactly what we're getting, and we know that it's going to be potent for the use that we're using it for. I mentioned earlier that ozone comes from when lightning hits oxygen in the air, and it's an interesting fact that 90% of the Earth's ozone layer is formed when the sun's ultraviolet energy hits oxygen. So it's a totally natural thing. It's supposed to be there. The remaining 10% of the Earth's ozone layer is generated by the Catatumbo lightning storms in Venezuela. They can produce 1.176 million lightning bolts per year. That's a lot of lightning. And all of that lightning is going to hit that oxygen in the air and generate ozone. A little bit of it's made like in waterfalls and waves that I mentioned earlier. Those bubbles come up and the sunlight hits it and make a little bit of oxygen. But most of the rest is from medical ozone generators, or ozone generators that are used in homes or in cars or in factories or whatever to deodorize the air. And here's a pictorial here for you so that you can remember waterfalls, waves, lightning storms, ozone generators for deodorizing things. Those are the different ways that we can create ozone, but then in the clinic, we do it in the controlled way that I mentioned earlier. So you might be thinking, well, what's so special about triplet oxygen or ozone? It's just still oxygen, right? Well, like I said earlier, I mentioned that ozone is far more energetic and reactive than oxygen. It basically has, this extra energy sort of sitting out there, and it makes it so that it's valuable to us for these applications like air purification, water purification, medical ozone therapies. In fact, I don't know if you know this, but in Las Vegas, the entire water system for the entire city is detoxified by ozone. They don't use chlorine there. And I believe France, I'm pretty sure, also uses ozone for their water system. So it's much safer. There's no chemicals in it. And, it's very reactive. It works very, very quickly. We'll give an example of that later. There are many medical uses for ozone. It can be used for helping the body to clear coronary artery blockages. It can help the heart function better. I'll describe later mitochondrial function, which is part of almost all diseases, but things like fibromyalgia, chronic fatigue, lack of circulation, gangrenous wounds, or any kind of wound, it will help heal that. Macular degeneration, there's been many studies in Cuba, and I think Brazil is the other country that tried both, or did use IV ozone and rectal ozone, and it did improve things like macular degeneration. Also, glaucoma was improved by it. Also, just aging. It slows down the aging process because it helps your mitochondria keep making energy in your body. Oncology, it's not the only thing you would use for cancer, but it does help the immune system function at a much higher level, so it can help get rid of some of those cancer cells. And then, of course, the infections that I talked about earlier, viral infections, bacterial infections like Lyme disease, yeast infections. We treat a lot of candida overgrowth in our clinic, and parasite infections. So ozone normalizes functions within the human body. It can help deal with the stressors of, like I said earlier, infections. It helps detoxification work better. It helps even out emotional mood. It helps healing from almost any injury. It helps improve the deficiencies in the immune system. It helps to detoxify from things we might eat in our diet that aren't healthy, and the stressors of allergies, and it will get all these different organ systems working better, like the adrenals, the liver, the kidney, the neurological systems. Like, people have reported that, their cognitive function, their brain is just working better after they've done ozone, or they have more energy. We use a lot for chronic fatigue situations. Immunity, uh, getting the bowels healthier and getting rid of those chronic toxins and infections there. Therefore improving digestion and metabolism and helping to balance hormones. It just makes everything else work better, and it affects all the systems. And I will explain to you later how this actually works because of the nature of how ozone functions. In this section, I'm going to talk about the safety and effectiveness of ozone. At the first International Oxygen Ozone Congress in April of 2006 in Brazil, there were 644 doctors that had been treating their patients with ozone therapy, and collectively they did over 5.5 million treatments on 384,775 patients. And this is mind blowing. They only had 40 adverse reactions and no deaths. That's an incredible safety record. So this therapy is very safe, and then we'll get into what it actually does here on the next few slides. I showed you earlier how the bacteria is destroyed by the ozone, but I really love this pictorial schematic, so I wanted to show it to you. In the first box there, you just have your bacteria all intact. And then you have those lighter green molecules of oxygen hitting the surface of the bacteria, and it's creating little holes in it. It's damaging it. See, those bacteria and other pathogens, they don't have antioxidants to squelch the effect, the oxidative effect of the ozone. And then in slide 4 there, down on the bottom, you'll see that the wall is continuing to erode away. The bacteria is getting punctured by the ozone, and then you've got lots of little holes occurring all around the bacteria in slide 5, and then slide 6 there just shows it breaking apart. So that's the process of ozone and how it kills bacteria and other pathogens. Again, I want to emphasize that ozone really is not toxic when it's used at a therapeutic level. It's not the therapeutic agent, it's the dose. So how it's used and the ways it's used, that determines if it's toxic or not. And that goes for ozone as well as many other chemicals and particles that we deal with. So in this next section, I'm going to talk about the science of ozone and how it works and the studies that have been done. So when ozone is compared to chlorine, a lot of people use chlorine for killing bacteria, getting rid of germs, so to speak. And you know how smelly chlorine is? Well, for 4,500 bacteria, you need 4,500 molecules of chlorine. And the total kill time is 3,500 seconds. That's quite a while. For 4,500 bacteria, it only takes 1 molecule of ozone, and the kill time is 1 second. So I would say ozone is much more effective, it's faster, and it definitely has a lot less side effects, almost none. So how does this happen? It happens by the process of oxidation. What are the various properties of ozone? Well, in vitro, we say in science, it's outside of the living organism. It's a very powerful oxidizer, killing all those pathogens, the bacteria and fungi and viruses I talked about earlier, at much, much lower concentrations than chlorine. And also, it oxidizes things like poisons, like phenolics, methanol, benzene. Also, it'll neutralize pesticides, detergents, chemical manufacturing wastes, and aromatic compounds more rapidly and effectively than chlorine. Yet chlorine leaves harmful residues like trihalomethanes that are not healthy for us. So ozone will take care of those toxins much faster and much cleaner, so we can use it for those purposes. So I know I showed you how microorganisms are destroyed by oxidants like ozone, but why is this? Why does that happen? Well, they lack antioxidant enzymes in their cell membrane. So the antioxidant membranes that are in normal, happy, functioning cells, they prevent the ozone from causing any damage. But in these pathogenic or poorly functioning, negative pathogenic cells, they lack the antioxidant enzymes in their cell membranes, so they get destroyed by the oxidation caused by the ozone. Again, why ozone? Why is it so special? Well, one of the main things that ozone does is it improves your ability to utilize oxygen in your tissues. Oxygen, as you all know, is very critical. You go, 2 or 3, maybe 4 minutes max without oxygen, and you're going to be dead. You need oxygen to live. It's very critical. It's more critical than water and food. But it's not just the oxygen you take in, it's what you use. Can you actually use the oxygen once it gets there to all of your tissues, not just your lungs, but the rest of the body? The difference between you at 20 years old and you at 70 years old is the efficiency at which you will utilize oxygen once it gets to that tissue. So the key to the treatment and prevention of disease is optimum oxygen utilization, and this can be changed with ozone. So let's take a closer look at that. Ideally, what we're asking ozone to do is help us with our therapeutic goals in the biologic system of the body. We want to restore proper oxygen metabolism. We want to induce a friendly environment where the cells can live in a healthy way. We want to eliminate pathogens. We want to increase circulation. We want immune systems to be activated when they're needed. And we want to stimulate a humoral antioxidation system. So in other words, we want to stimulate the production of antioxidants. Well, this happens by helping our mitochondria to function better. You have about 2,000 mitochondria in every cell in your body. Pretty amazing, isn't it? Your cell has these little factories in them called mitochondria, and thousands of them are constantly creating energy so that you can do what you need to do at the cellular level to detoxify, to use energy, to create new cells, to tell the cells when they should die off and be shedded to make room for another cell. So these energy factories in every cell, this is where that oxygen utilization occurs. That's where you've got to get the oxygen used so that you have better functioning of every system in the body. You must have mitochondrial function, and if it's not optimized, then you are going to age or you're going to get some sort of disease. So what really is mitochondrial energy? It's the energy produced by the mitochondria, and it's called ATP, adenosine triphosphate. We absolutely must have this to live our best lives, and we want to make as much of it as possible. And we want to keep those mitochondria working. The 10 million trillion mitochondria in your body consume 90% of our oxygen intake. So when it gets there, we want it to be able to use it. Mitochondria combine calories from food and oxygen to create the body's cellular energy source, ATP. And so this really is what oxygen utilization is. And oxygen utilization equals ATP, it equals life, it equals longevity, it equals less disease. And oxygen utilization, this is enhanced by ozone. This is why ozone is so wonderful, because it works in every cell in the body. It's not just treating one bacteria or treating one disease or treating one problem. It is treating the main problem of that's part of all diseases. So you've got things going in like T3 from your thyroid, the active thyroid hormone, cortisol, other hormones like DHEA, various nutrients, your toxins, those are all going into the cell. Oxygen's going into the cell. Fat's going into the cell. Sugar, blood sugar is going into the cell if it's working properly. And then you're going to excrete some free radicals. That's part of the process. That's normal. We just don't want to make too many of them. And then you're going to utilize that oxygen to make ATP. So this is like a little schematic of how that all works. And what are the effects of better oxygen utilization? Well, better organ function, better senses, better repair of tissues, better thoughts, better mood, better reproduction, better digestion, better hormones. Everything functions better and works better and does what it's supposed to do when we have oxygen utilization happening or mitochondrial function happening the way it should to make us energy for our cells. So you may have guessed by now that the basis of life and health is what? Energy production and oxygen utilization. And hopefully I explained that in clear enough terms so that even if you don't have some kind of scientific degree, you can understand that you must make energy and utilize oxygen at your cells for them to function correctly and to reduce or cure or improve or avoid disease. Oxygen utilization is really what you would call a person's aerobic capacity. The process whereby you're taking that oxygen and you're metabolizing the fat, the glucose, the water, the heat, the NAD, the free radicals, and the carbon dioxide and making ATP. Oxygen works through NAD and ATP. You need both of those for the system to work. These oxygen intermediates are at the bottom line for all cellular function. And this is the Krebs cycle. You may have heard about it if you ever took a chemistry class. Some of us had to memorize it. But basically, you can see all the yellow spots there where the NAD or NADH, and then the red where the ATP is produced, and all the different things that go into that amino acids, cortisol, thyroid, fatty acids. B vitamins are somewhere in here as well. Those all help this process. So that's why diet, detoxing, keeping the body getting what it needs, exercising, and just taking care of oneself is so important so that this process takes place and you make the energy for yourselves. So, what might you notice in the body if you had significantly decreased oxygen utilization? Well, you might feel cold a lot, so you'd have decreased temperature. You might have a chronic disease. You might just feel weak in general. You might feel fatigued, or you might have generalized pain like fibromyalgia, or you might feel a little short of breath when you exert yourself. That's dyspnea, that's shortness of breath. When you do things, there could be other causes for that, like congestive heart failure or COPD, like, your emphysema and things like that, or asthma. But if there's really no other cause for it, it could mean that you have low oxygen utilization or even exercise intolerance. Sometimes we say that, adrenal fatigue is, you don't often tolerate exercise well when you have adrenal fatigue. It also could mean that you have decreased oxygen utilization and just a general sensitivity to being cold because that circulation's not as good as it could be. There is an association between oxygen utilization and longevity. They've examined the associations between longevity and these individual variations in the resting oxygen utilization in mice. And basically, there was a positive association between improved oxygen utilization and lifespan. Mice in the upper quartile of the oxygen utilization lived 36% longer than mice in the lower quartile. So the mice that had better oxygen utilization lived 36% longer in this study. That's quite significant. So the problem with decreased oxygen utilization is that you really are having hypoxia a lot of the time, lack of oxygen. Now, this wouldn't show up on a pulse oximeter, the little gadget that you put on your finger to see what your oxygen saturation is. That could look completely fine. But at the tissue level, at your liver, at your brain, at your big toe, wherever, those cells are not getting the oxygen to make the ATP and make those mitochondrial energy factories work. So it is a type of hypoxemia at the cellular level. And it does generate lots of extra free radicals, which we know aren't good. They can damage tissues, predispose you to cancer and other things. It deprives cells of those vital functions, including repair mechanisms, membrane polarization. That's how cells communicate to each other through those electrical messages. Enzyme synthesis. It includes the synthesis of antioxidant enzymes, and ozone treats that. So this combination ultimately destroys your mitochondrial function, and death will ensue due to zero oxygen utilization eventually if nothing's done about it. We would call this decreased oxygen utilization functional hypoxia. Like I said, it's at the cellular level, and you have decreased oxygen utilization, you're going to have mitochondrial delay or decay, and you're going to have degenerative diseases, and you're going to have faster aging. Think about people that smoke. Over the years as a doctor, I've seen many, many people that have been smokers, and you can see it in their skin quite often. Their skin is more wrinkly, it looks drier, they just don't look as healthy. You can tell that there's something that's wrong, and that's because they're depriving their cells of oxygen utilization by putting, those chemicals and that smoke in their body. Let's talk about oxidative damage and mitochondrial decay in the kind of aspect of aging. Oxidants generated by mitochondria appear to be the major source of oxidative lesions or problems that accumulate with age. So, if you have more damage at the mitochondrial level or less function of the mitochondria making that ATP energy, you're going to age faster. And then these lesions cause the age-related deficits in mitochondrial function, and they're associated with generalized physiological decline known as aging. Now, we're all going to age. If we do ozone every day of our life, it's not going to stop us from aging. We're still going to age, but we're going to age more gracefully. We're going to have less wrinkles. We're going to feel better. We're going to want to, just get up and conquer the world and do new things every day, and we're going to still be interested in life. So, these oxidative problems are caused by reduced oxygen utilization, which ozone treats. I want to go over free radicals and oxidative stress real quick here, because some people think, ozone works through oxidation. That's bad for you. You're going to be making lots of free radicals. It's not healthy. Well, this is the twist in ozone, because yes, there are some free radicals that are made through this process, and it does utilize oxidation, but those free radicals are only bad if they're not controlled. So what controls free radicals? Antioxidant enzymes. And what stimulates this enzyme production? Ozone therapy. So ozone's got it covered. You're not going to have ill effects from ozone. It's going to produce the antioxidant enzymes that are going to make you healthier and handle any free radicals that are produced by the process. Specifically, how does ozone work? Well, it forms peroxides. Like, you've all heard of hydrogen peroxide, right? Well, what happens at the cellular level with ozone is it reacts ionically, is the term, with double bonds to produce peroxides called ozonides. And this is how we can use ozone in a nasal insufflation. We basically create peroxides from the ozone, because you don't want to breathe ozone in directly because it can irritate your lungs, but you can breathe in peroxides. So the same thing is happening at the cellular level. If you use IV ozone or you use rectal ozone, it's immediately reacting with those double bonds and making peroxides called ozonides. And most ozonides are formed from the short-chained lipids in cell membranes. Ozonides are stable for days to weeks. They easily penetrate cell membranes and they're selectively reactive. And once in the cells, these ozonides oxidize the NADH to NAD. Remember that funky chemical diagram that made your head spin? Well, all those yellow spots with NAD, the ozonides oxidize NADH to make NAD, which makes the whole process of mitochondrial function, oxygen utilization, and the production of that ATP energy more possible, and then health as well. So for you science nerds out there, ozone increases the NAD to NADH ratio. Like this, when you get down to the nitty-gritty of it, this is what ozone is doing in the body. Now, there is no test for this. You can't measure NADH or NAD. We just know that in clinical studies, this is what's happening. With ozone therapy, you oxidize NADH to NAD. This corrects the ratio and thus improves oxygen utilization, and it stimulates increasing levels of NAD. So it's this process that just keeps going and going. And this action of ozone therapy is enhanced with the addition of things like niacin, riboflavin, methylated B12, methylated folic acid, B6, and some people take oral NADH to help this process too. So all of these nutrients are needed for that Krebs cycle that I talked about earlier to help mitochondrial function. So in summary, as oxygen utilization gets worse, loses efficiency, the rate of free radical damage will escalate, and ultimately it does lead to mitochondrial decay and early aging and disease. We're in integrative medicine, we're trying to slow that process by many different mechanisms. And accumulating this mitochondrial decay, it is the central lesion or problem in the aging process. It's really why you can't live forever. But your risk for premature aging and degenerative disease is determined by your starting point, the genetics and that sort of thing, and the rate of the mitochondrial decay. And your starting point, that's genetically predetermined. But your rate of decay is modifiable with ozone and with other things like diet, exercise, attitude, and many other therapies that we offer in integrative medicine. But ozone is a really great tool to modify the rate of decay that you can control by many different things, including ozone. With that said, since decreased oxygen utilization is the primary cause of degenerative diseases, basically the treatment of all diseases, including aging, autoimmune disorders, cancer, vascular disease, et cetera, et cetera, et cetera, it's maximally enhanced in the presence of optimal oxygen utilization. So this is why ozone therapies really can be used in virtually every patient, every disease. And again, it's not the end all be all cure everything panacea. It's like not a wonder drug or something like that, but it is a huge tool that we have in this, process of trying to, improve not just longevity or length of life, but quality of life and decrease the presence of disease in our lifetime. I mean, I myself am working on this. I have a father who had Alzheimer's, and I had several aunts on my dad's side of the family. And I know there's some genetics in the family history. And then there were definitely chemical and other, radiation type insults and things like that that brought on or made the mitochondrial dysfunction just get worse in our family members. So I'm looking at this personally for myself as well. And I'm understanding this to stave off the possibility of Alzheimer's and dementia in myself as I age. Which I think you can do. And So I think we have a fighting chance with these tools. It's really exciting to be able to work with ozone and help people in all stages of disease, illness, or just for prevention. And I sort of alluded to this earlier. Really, ozone is one piece of what we can do to help ourselves stay healthier or fight the progression of disease. But if you want to maximize that, the best thing to do is do other therapies at improving oxygen utilization, diet, nutrition, detoxing regularly, balancing your hormones, controlling your stress, controlling your intake of things like coffee, alcohol, improving your sleep, your emotions, your allergies, your sugar intake, and ozone therapy. Now, there are a few contraindications. Those are things that we should not be doing ozone with, but they're kind of common sense as well. We always check the G6PD enzyme, and if somebody has a deficiency, you really shouldn't be doing ozone on them. Or if you do it, you have to go with really low dosages, and sometimes that will stimulate the system to make more G6PD. We check it on everybody. It's actually very rare that it's low. I've only seen it in 2 people ever in my practice. Also, you want to not treat somebody who's in the middle of a hyperthyroid storm. You know, if they have high heart rate and they have all these other things going on, you have to take care of that emergency first. Also, if you have thrombocytopenia with platelets that are below 50,000, we do not want to do this treatment. If you're unstable cardiovascular wise, we don't want to, if you're having angina or something like that, we're not going to do ozone therapy. Or if you're intoxicated with alcohol, that would be a very bad time to do it. If you have active seizures, if you have uncontrolled hemochromatosis, that's where you bleed very, very easily. If you just had or are in the middle of having an acute heart attack, MI, that's myocardial infarction, or an acute CVA, cerebral vascular accident. So if somebody's in the middle of stroke, you're not going to do ozone therapy on them. So also patients who are receiving treatment with iron or copper, you wouldn't want to do it at the same time. So those are very simple, very rare, actually, contraindications that we know we wouldn't do ozone at the same time. In this lecture, I'm just kind of scratching the surface of some of the research and things that ozone does. But there are many, many, many more published papers, especially over in Europe. We know it's anti-infective, bacteria, funguses, viruses, parasites, things like that. It also enhances chemotherapy and radiation treatments. It also activates NRF2, NRF2. It's a basic protein zipper, a leucine protein zipper that regulates the expression of antioxidant proteins that protects against oxidative damage. So ozone helps this system, so it prevents oxidative damage. So another thing that has been studied specifically with ozone. NRF2 is really a master regulator of cellular protection. We call it cytoprotection. It increases detoxification, it regulates production of phase 2 enzymes, it enhances stability and turnover of proteins, it reduces inflammation, it protects against neurodegeneration, it's anti-tumorigenic, so anti-cancer. It promotes apoptosis, which is normal cell death. It should happen. You want to get rid of those old yucky cells that aren't working that well anymore, and it promotes longevity. There are many methods of medical ozone administration. There's what we call major autohemotherapy, or MAH. That's where we put it in an IV and give it to you. There's minor autohemotherapy. We don't use a lot of it, but it is a less expensive way to boost your immune system. There's Keyzone, where you do chelation, IV chelation, and then you alternate it with ozone therapy. Also, rectal insufflation. We have most of our cancer patients do that because it's a very easy thing that they can do at home and it's very inexpensive. Also, limb bagging. I'll show you some pictures of that being done. Prolozone, where we do prolotherapy shots and then follow it with ozone shots. Ear insufflation for ear infections or ear irritations. Bladder insufflation. Now, I don't do bladder insufflation at my clinic, but it can be done. Ozonated water. You can actually get an ozone generator. We have one that we sell at our office from a reputable producer, and you can get the setup for making your own ozonated water. It's not very efficient. You have to drink it within 20, 30 minutes, but you can make ozonated water. Many of the dentists that we refer to use ozonated water to clean their equipment. Sometimes, if people don't have the ability to donate the blood, that it's a very small amount, but if people had bad veins, sometimes you can't get a lot of blood, so we'll ozonate saline and give it to them. Ozonated oils, we use those for skin lesions, infections, dog bites, things like that, burns. Um, UB isode injections, those I do not do. That's another kind of almost homeopathic form of using ozone. Ozone saunas, we do have the Hocket ozone sauna, which I'll talk about a little bit later. And then the inhaled nasal therapy, inhaling the peroxides, and vaginal insufflation, which you can do when you're in the Hocket ozone sauna at our office. If you're a female, you can do that, or you can do cupping of either breasts or not prostate directly, but the scrotum or the area near the prostate. And we've had reports of men being able to urinate more easily by doing that in the Hocket sauna. So let's quickly go through some of these therapies. The major autohemotherapy, or MAH, which is IV ozone. This is one of the primary uses we use at our clinic. It's really nice. It's very effective. It's probably been studied than any other form of ozone. What we do is we take about 60 cc's of blood, which is not very much, and we put it in a bag with saline, and then there's some heparin in there so that the blood doesn't clot. And then we add calcium chloride to activate it. We don't add glutathione to ours, but it can be. And then once the ozone is put into the bag, basically all of that blood latches onto the ozone and it turns bright red, and then that is put back into your body to start that whole process to get your cells to function better and your mitochondria to function better. One of the things that's been studied with ozone IV therapy is the production of good cytokines. These are definitely increased when you do IV ozone. On this little table here that I took a picture of, and it's a little bit funny looking, but basically it shows that all of these different cytokines are increased after ozone therapy, and there's no toxicity, and the ozone increases the production of these things, so it makes your immune system work better. With the IV ozone, or major autohemotherapy, or MAH, basically we use this to treat all kinds of infections, chronic overgrowths, shingles. It works great for shingles. There's a little program we have for shingles that we do. Post-COVID, other infections, arthritis, fibromyalgia, chronic fatigue. We use it in our cancer patients along with other therapies, heart disease, autoimmune disease, and neurodegenerative disease. So ozone is a circulatory stimulant. It activates the red blood cell metabolism, and reactive oxygen species like the peroxidated lipoproteins lead to charge modification and improved flexibility of the red blood cell membrane. So what does this mean? It means basically that your rheology, or your ability of the red blood cells to move through the blood, is smoother. Your circulation's better because things are flowing better. So that's one of the things that ozone does. So this is a picture of minor autohemotherapy. We don't use it that much because IV ozone is just so much more potent. But let's say you had just a recurrent, irritating infection like a herpes lesions, or um, let's say you couldn't afford IV ozone, or if it was just like seasonal allergies or conjunctivitis or things like that, congestion, you could do minor autohemotherapy. That's where we take 1 to 3 cc's of blood from the patient's vein and we mix it with 3 to 5 cc's of ozone, and then we just inject that mixture back into the muscle. You could do it in your deltoid if it's not a high amount. You could, most of the time, we do it in the buttock, in the gluteus muscle. So that's another way to get ozone, and it's a little bit cheaper too. It's not going to be as potent, but it is a great immune stimulator. So this is what the setup looks like for rectal ozone. You've got your bag, your tubing, and then your catheter. And then basically it's just a great way to get the ozone up into the GI system, because the GI system is also attached to the hepatic vein. You're actually going to be getting it through there going into the heart. Now, you don't have ozone going directly into the heart, but the effects that are created by the ozone locally in the rectal colon area, then that chain reaction then affects the GI system, the gastrointestinal system, and then the vasculature that's connected with the liver and therefore the heart most when you do it this way. But it is a great way. It's probably the second best way compared to the IVs, and it's easy to do at home. Okay, now rectal ozone, rectal insufflation of ozone. A lot of people are just like, what? You're telling me I'm going to put, ozone gas up, there. But it's really super easy. A lot of us doctors do it a couple times a week. You can do it at home. It literally takes less than a minute. It takes more time to fill the bag from your ozone generator than it does to actually do it. And it's super easy. You're just going to basically attach this bag to the ozone generator. It's going to put ozone in the bag. You're going to put a kind of some tubing with a catheter on the end of it. And then you're going to insert that using a little bit of olive oil or something into the rectum. And then you're going to roll that bag down and push that ozone gas into the rectum. And it's called insufflation. And the ozone, in about 30 to 60 seconds, it's done its thing. It started the process that it's going to start, and it starts working immediately. Right afterwards, you might have to feel like you have to have a little bowel movement, and usually it's just a little bit of air comes out and maybe a little mucus or something. But there's usually no rectal irritation or abdominal pain. If there is, then you should decrease the volume, and we usually work people up to 400 cc's with this treatment. But I try to get most of my patients that are active cancer patients, I try to get them to do it 3 to 5 days a week, because it is so good for your immune system. And if you get the whole setup, it's cheaper than doing IVs. This slide is really hard to see, but I just wanted to put it in here to remind myself to tell you that when you have a hepatitis patient and you do rectal ozone, they actually did studies with them. And it basically showed that the bilirubin values in hepatitis B patients after rectal ozone, they were compared to a control group that did not get ozone, and they got better faster. And then your other graph there on the right with the lines that are going downward, it basically shows that they had a significant difference between the treated and non-treated group. The guys that got the rectal ozone got better a lot faster. Those are the lines on the bottom where it just goes straight down, and they're improving quite quickly and getting into more of a normal state. So ozone does work rectally for hepatitis. All right, so this is ozone limb bagging. Basically, we're going to put like a little moist cloth in the bag with a bag that's over, let's say, an affected part like a foot or a leg or something. And then we're going to pump ozone into that bag for about 20 to 30 minutes. And it's great for fungal infections. It's also great for just cuts that won't heal, helps diabetic feet. I'll show you some pictures of a baby that got limb bagging for an infection in his toe. So this is a very young child. I think he was like 13 months old, 14 months old. He had a very infected pinky toe. And it was so infected, they were actually thinking of amputating it. And the mother was just like, I got to find something else. And she found somebody doing ozone limb bagging. And here's the picture of the little guy on his mom's lap, and he's got his little foot in the bag. You can see there's that little white thing in there that's for the humidification part of the process. You put that wet little towel in there, and then he just sat there with his foot in the bag for 20 to 30 minutes with his mom. And these are pictures of the results. At 7 days, it was looking less red and irritated. 10 days, all the kind of dead skin and whatnot was peeling off. And then look at that toe on day 16. And he was basically doing it every day that the clinic was open. I think they were doing it 4 or 5 days a week. But day 16, that toe looks completely normal. And they were going to amputate that toe because they had tried antibiotics. It wasn't working. As it turned out, they sent out a viral culture, and he had a herpes infection on his toe. It was viral. It was never going to respond to antibiotics, but it did respond to the ozone limb bagging. It worked beautifully. Speaking of viral infections, herpes infections, there was a study where they injected subcutaneously ozone, O3, and apparently avoided relapses in a group of 84 patients. So they think ozone might be interfering with the ganglion, the nerve that uptakes the virus. In this situation, you would also consider ozonated olive oil topically. You would also consider doing either the minor or major autohemotherapy, that's the IV or the injection, and maybe drinking ozonated water or making ozonated ice cubes. All of these things would help to add to the ozone effect. But for herpes simplex, it did really seem to make a difference in this group of 84 patients. So this is a picture of how we do inhaled ozone therapy. Now, again, I want to emphasize that person is not breathing in straight ozone. Basically, that ozone is being made into peroxides by bubbling it through olive oil. We, in our machine or our setup, we refresh the olive oil regularly so it never goes bad. And you just sit there for 10 to 20 minutes breathing in the peroxides. They do not irritate you at all. They don't irritate your lungs. And you can do it every day if needed. We use it for various things like allergies, you know, infections in the nose, recurrent sinuses and sinus infections and things like that. Now, this is a picture of a girl receiving ear insufflation of ozone. You can do it for infections, ringing in the ears, upper respiratory infections. Actually, you are getting a little bit of a systemic effect when you do ozone through the ears because they're so vascular. There's a lot of vasculature in there, and that's going to take that process systemically because it's going to mix with all the other vasculature through the ears. I've heard it suggested that if people have brain tumors, this would be a good thing to help them. There's no studies on that, but basically you just run it for 5 to 10 minutes and, do it. You can treat it up to twice a day. We've never had anybody do that. Usually it's more like 2 or 3 times a week, but it works nicely. Ozonated oils are another way that you can deliver ozone to the body. A lot of times people use it. We have ozone age cream at our office that has ozone in it, and it's for wrinkles and skin rejuvenation. But you can use it for burns. You can use it for cuts. You can use it for bites. We had a great case that I wrote up in my diplomat presentation to become a diplomat of ozone therapy. She'd been bitten by a dog and it was infected, and they'd done a round of antibiotics. They were going to do another round. They were going to send her to the wound clinic. And within 2 hours of applying ozonated olive oil, the inflammation went down like 60 to 70%. And it just kept healing and healing faster and faster. And she was just as shocked as I was that it worked so well. But yeah, those it's always something that you can use, immediately topically, and you wouldn't want to get it in your eyes, but you can put it in your mouth. You can put it on your gums, things like that. These are some examples of using ozonated olive oil. This was 2 months of treatment put on twice a day. This fellow, I think this is from Colombia, some missionary doing work down there, had all of these warts on his hands, and warts are caused from viruses. And the ozonated olive oil, if you consistently put it on twice a day, every day, eventually the warts will go away. And that's his hands in the second picture that are totally fine. And in this picture, this is 3 weeks of ozonated olive oil twice a day. This little guy in the picture, he's got all these little bumpy things on his forehead and face, and in 3 weeks, they're totally cleared up in the picture. And again, this is a doctor doing missionary work, I think, in Colombia. So this is our ozone sauna. It's called a Hocket. You basically do 30 minutes per treatment. You usually don't do more than twice a week, at least starting off. You could do it 3 times a week if you wanted to. Occasionally, I think only twice we've had an ozone rash. There is a way to get around that. We can put a certain lotion on the skin, and then you don't get the rash, but you still get the ozone. But it's pretty rare. You do have to be careful with people that have like unstable blood pressure, low blood pressure, because it can be very calming to the nervous system. I usually fall asleep when I go in there and I get a Hocket sauna. And you have to be careful with people that have breathing problems. But other than that, there's really no other contraindications. If you can get in and out, you can do it. I try to do 1 or 2 of these a month. I alternate it between doing the Hocket ozone sauna and doing hyperbaric oxygen chamber as part of my routine to keep my body young and healthy and prevent me from getting Alzheimer's like my dad did. So the Hocket sauna has all of these modalities built into one machine. It's got a heat source, which is far infrared. It's got steam going on in there too. It's got carbonic acid going in, and that combines with the steam and the oxygen in there, and it improves your circulation, calms the body, helps the ozone to get dropped off in the tissues in the bodies. It's got ozone, of course. It's got electrotherapy. You can do little movements in there so you get your heart rate up a little bit more, and you've got oxygen going in at the same time. So you're kind of exercising with oxygen therapy. It's not the classic version of it, but you are doing some of that. You're getting some hyperthermia because everything's exposed except for your head, and you're getting photon light therapy. There's a little light show that's going on inside this all the time. And then we have aromatherapy. There's a little well at the bottom, and you can put any essential oil in there that you choose. But it's a great set of therapies that work synergistically to help detoxify the body and help get ozone into the body by another delivery method and help all the things that we previously talked about. So these are all of the things that the Haka ozone basically can help the body with: detoxification, improved cardiovascular function. A lot of athletes will get in the Haka ozone sauna before, an event. They'll do 3 or 4 treatments the week or 2 before an event. Helps blood pressure, improves judgment and discernment because it's very calming to the body. If you're an anxious person, it helps get your parasympathetic nervous system working better. Um, Sexual vitality and stamina, extending the healthy years of your life, able to maintain a healthy weight. This is just part of a program for that. Weight is very complicated, so I wouldn't use this for weight loss alone, but there is a little program in the electrotherapy for that. It helps your skin, it improves mental clarity and memory, increases energy. And I can testify noticeable pain reduction because I had tendonitis in my shoulders at one time several years ago. And every time I would get out of the Hocket, it was completely great for several days. and I just kept doing it until it was totally healed. Um, it also reduces chronic infections and inflammation, and so there's many, many uses for the Hocket sauna, and it's all doing it in this one unit, 30-minute treatment. And we recommend you do what we call the Detox 10. And then if you're more unhealthy, you need more help, do 20 and then do maintenance like once every week or two. All right, and we're kind of winding down here. We're getting down to the last few slides here. We got prolozone therapy. This is where we do prolotherapy. That's injections that we do to strengthen ligaments, connective tissue, cartilage, and we do it for like joint pain and things like that. And you can, after you put the prolotherapy injections in there to help heal the tissue and regenerate tissue, if you inject ozone in the same areas and in the musculature beside it, it improves the whole pain picture and the healing picture. It was actually studied in patients that had damaged discs and were on chronic pain medication. And it proved that they reduced their pain medication, they reduced their pain levels, and in these guys, they didn't even get injections into the actual spine. The injections were all done next to the spine in the muscle, and it had that effect. And when you inject ozone, it's kind of interesting. You can also see it just kind of it fuses into all of the fascial planes. So it doesn't go just where you inject it. It just fuses into, all of these areas around where you inject it. So that's a nice way to deliver it as well. When we're using ozone for recovery from a stroke or a brain injury or, um, early forgetfulness or cardiac problems, obviously you're going to combine this with conventional medical therapy to help your arteries be healthier. We often combine it with chelation IV therapy and just alternate them back and forth. But we start at a low dose and work you up to a higher dose, and we do it 1 to 2 times a week until you're better. And then usually in these people, there's some kind of a maintenance treatment, like once a month or something. But usually you're going to see some improvement after like 14 or 15 treatments. So this is use of ozone therapy for macular degeneration. It was studied, and it basically is shown that it works in both wet and dry forms. I think it's a little bit better in the wet form, if I'm remembering correctly, and it'll stop the progression in 100%, but it, doesn't always improve the visual acuity. But what they did see is about 60 to 70% in some of the studies they did. They usually do the IV version of ozone therapy, start at a low dose and work up to a higher dose, and then do it 1 to 2 times a week. Usually you're talking about 20 treatments for something like this. If it's more severe, you might need more. But then you would have their eye doctor, monitor the visual improvements after these are done. Okay, there's been many studies on macular degeneration, and Riva Sanseravino has been one of the people that's done a lot of this research, and basically doing this for about 4 months at once a week, IV ozone. She showed that the majority of the patients showed an improvement in their eye condition, and it suggested that they needed more studies. This is the detail of Riva Sanseravino's study on macular degeneration. They did the IVs once a week for 14 weeks, and it shows both the dry and wet visual acuity, the results, and the dry definitely got better. It improved 44%. There was a small percentage of people that were worse, so obviously they weren't benefiting, and then about 50% of them were no change. And then the wet macular degeneration, they had no change in visual acuity. And then at 4 months, they checked them again, and the dry macular degeneration, 38% improved, 5.5% worse, 55% no change. But the wet macular degeneration, they did have a little bit of improvement, but it was quite a bit less, 13% improvement, 80% got worse, 68% no change. So it definitely works better with the dry macular degeneration. Um, and they also looked at the eyes with fluorangiography and saw basically the same results. It improved. So Dr. Sylvia Mendez also looked at eye disorders, but she did her studies with rectal ozone, and she looked at macular degeneration and glaucoma and retinitis pigmentosa. And here we show some of the data for the glaucoma patients, and their visual acuity improvement was between 69 and 72%. And the visual field expanded as well between 59 and 76%. And there was also a trend where the intraocular pressure lowered as well. So some really good results. And this was just with, rectal ozone. And they saw similar results with retinitis pigmentosa and macular degeneration. So for aging and chronic fatigue states, we can use almost any form of ozone medical therapy and it will make some difference. The best one is going to be the IV major autohemotherapy. You can use the rectal intestinal version, the sauna, ozonated saline, 1 to 2 times a week. And usually you'll get results after about 14 treatments. You have to also address any other imbalances, hormonal imbalances, nutrition imbalances, toxicity imbalances, and then usually do some kind of a maintenance treatment, usually once a month. So in the oncology or cancer world, there's several mechanisms at play here that ozone would help the patients. You're increasing antioxidant enzymes and you're getting the healthy cells to be healthier. And then the ozone will protect against the side effects of the chemo and radiation. It improves the efficacy of chemo, radiation, vitamin C IVs. It decreases resistance to chemo. And it induces anti-cancer cytokines, TNF, IFN, IL-2. It could come in direct contact with cancer cells and kill them, but that's not usually the case of how we're really utilizing this. It kind of may normalize a marginal cell that maybe wants to become a cancer cell by stimulating, the mechanisms in the cell to function better, and it may help to stimulate apoptosis, which is the programmed cell death for getting rid of those old yucky cells that aren't working as much anymore. And I do want to say that as far as oncology, you would never do ozone as a standalone treatment. Hopefully that's obvious. You have to combine it with many other therapies for cancer. Now for acute infections, this is probably what we use it most for. You can combine it with any conventional therapy that is required. We usually start at usually at least 100 cc's of the ozone and do it intravenously 1 to 2 times a week. You can work up to 200 cc's, and it's something that you can see improvement in somewhere between 3 and 5 treatments. For shingles, we usually do 3 to 6 treatments. Um, and you can do other therapies right after. Like if you also wanted to do a vitamin C IV, you would just do the ozone IV first and then follow that with the vitamin C. And the reason you can do that is the effect of the ozone is basically immediate. It's going to work immediately. It's going to start this process that's a chain reaction. So anything you do after that is not going to nullify the ozone. Now, we have used the IV ozone or major autohemotherapy for many different viral infections, hepatitis, Epstein-Barr. Now hepatitis has a medical treatment, so we don't really have to worry about that anymore, but there's many other viruses that would respond to this IV ozone therapy. And again, you can combine it with any other conventional medical therapy. And again, just like most of them, you're going to start at a slightly lower dose, and then you're going to work your way up to a higher dose and do it 1 to 2 times a week. With the chronic infections, I tell people like chronic Lyme and things like that, that they've had for a long, long time, co-infections with Lyme, things like that. It's probably gonna take minimum 20 treatments, might take more, and then you're gonna have to do all of the other things to help normalize all of their functioning as well. And this would include any, like, acute bacterial infections, long-standing ulcers, bone that doesn't wanna heal, things like that. You can do this on top of any conventional therapies that they're doing. Okay, so for any autoimmune disease, you can improve that mitochondrial function and therefore cellular function. So, think of things like MS, lupus, rheumatoid arthritis, polymyalgia rheumatica, any kind of autoimmune disease, and you want to stick with higher doses. We often will combine this with the ultraviolet blood irradiation treatment that we do at the clinic. Um, Even if you're just treating shingles, you're going to get more out of the ozone if you combine it with the UBI. At our clinic, we just call it UBI with ozone. So it's a great therapy, and we've seen cases really turn around with doing some of the ozone therapy. We can also use ozone therapy for ulcerative colitis and Crohn's. Those are inflammatory bowel diseases. Basically, we recommend the major autohemotherapy 1 to 2 times, sometimes per day, but definitely at least 1 to 2 times per week. It would vary on the case depending on how sick they are. They can do rectal insufflation, but they have to start out with very low doses and do it gently so it's not irritating the bowel or stimulating increased bowel movements or something like that. But it is combined usually with the gut repair protocol. Sometimes we do the supplement protocol first, and if it's not working as well as we would like, then we'll add the major autohemotherapy IV ozone. So now you have my secrets to immunity plus health and longevity with ozone therapy. And, hopefully you don't need this for an acute infection. But if you do, yeah, let us know. We can get you in right away to do this. It's a good thing to think about with flu season coming up. Flus and colds with the change in the weather and people being inside more. It's a good time to think about, okay, what things can I do if I get sick? And one of those things is IV ozone or IV UBI with ozone. And again, apply all those things that we've tried to teach you at the clinic, eating well, getting your vegetables in, eating the rainbow, taking care of that body, exercising, um, just doing all the things that we teach you to keep the body healthy and taking your supplements regularly as well. But if you do get sick, we have a little program we do for shingles as well that usually clears up within a week. So if you get these acute infections, don't hesitate to call us. Let us know that it is an acute condition, is something that needs to be treated right away so that we can get you scheduled right away to get that handled. And if you have any questions for us, please don't hesitate to call the clinic, 616-550-2943. I thank you so much for listening, and I hope you get a lot out of this. If you want to schedule anything or have a consult with one of our providers, let us know. And please check out our website too, nhicwestmi.com. We have lots and lots of information on there so you can learn about all the different things we do to try and keep you healthy and help get you fixed up when you aren't feeling so well or you have a chronic disease. And here is our information for the clinic, our website, our Facebook page, our Instagram, our YouTube. These videos will also be placed on YouTube so you can watch them. They'll also be on our Facebook page. If you do have questions or comments, you can put them in the comments below on the Facebook, and someone from our office will get back to you within 1 to 2 days, or you can just call the office if you'd like as well. 616-550-2943, Natural Health Improvement Center of Granville, Michigan. Bye now.